Good morning, good afternoon, good evening, everyone. You're welcome to today's episode of Public Health in Real Life, a channel where we hope to highlight key global health issues, celebrate unsung heroes from the field, and inspire the next generation of public and global health professionals. Today's episode, I'm pleased to welcome my co-host Ashwin Kadambi.
Hello, everyone. Welcome to Public Health in Real Life. Thank you so much, Maimuna. And today we are talking about implementation research and national TB programs. And to understand implementation research, we need to talk about translational research. And the Dr. Stephen Wolf in Virginia Commonwealth University has provided by far one of the best definitions of translational research. He says that it's, quote, translation research refers to translating research into practice, ensuring that new treatments and research knowledge actually reach the patients or populations for whom they are intended and are implemented correctly. So, to break this down, the Institute of Medicine's Clinical Research Roundtable divided the definition into two definitions. The first one is transfer of new understandings of disease mechanisms gained in the laboratory to develop new methods of diagnosis, therapy, and prevention, and first testing in humans. And then the second definition is about translating those clinical results from clinical studies into everyday clinical practice and health decision making. So if you see, the first part is all about the biological and technological solutions, and then the second part is about implementing it in everyday clinical practice. And translation research requires that as much as we have knowledge of areas such as proteomics and DNA and genetic therapy, we also need to understand the reality in the ground about health equity, poverty, social determinants of health. To have that mastery in translational research, we need mastery in implementation science, which is really that second part of translation research. And it involves fielding and evaluating interventions in real world settings, and that requires that we have informed understanding of the designs of interventions, and we need understanding of clinical epidemiology, evidence synthesis, communication theory, public policy, donor finances, and all these areas within implementation science needs to be addressed so that we can have a successful addressing and response to any disease eradication or ending of any particular disease. And today we are talking about tuberculosis, and we know about tuberculosis has been it's still we are struggling as a world to address it. And today we have Basant Joshi to talk us and walk us through implementation research in and its implementation in national TB programs. And Basant Joshi has completed his bachelor's and master's degree in microbiology at the Tribhuvan University in Kathmandu, Nepal. He has done his master's in public health in University of Gajah Mada in Indonesia. He's currently the PhD fellow within the TB Speed project at the University of Bordeaux in France. And he has worked with multiple organizations such as Save the Children, FHI 360, WHO, and he's also a TDR Global finalist, which is a wing within WHO, supported by the World Bank, UNICEF, and UNDP, to support scholars who are studying tropical diseases. We are extremely pleased to welcome Basant Joshi. Welcome to the show, Basant. I think you're on mute, Basant. Just a moment. No problem. You can just maybe reconnect if possible. We're still not hearing. Not yet. Maybe just you can check the connections. No, it's still a bit muted.
Is this okay now?
Perfect. Yep.
Okay.
Welcome.
Okay. Maybe I will remove the headset for now.
Not a problem.
Thank you, Aswin, and we have Memunat. Maybe sorry for me mispronounce. And hello everyone. Good afternoon and namaste. Now I couldn't hear you.
About it. Can
Okay,
you hear me now?
Yeah, it's good now.
Okay, fine. So anyway, I know I provided a little bit of introduction to implementation research, but could you give our audience a bit more understanding about what is implementation research and why is it important in public health?
Yeah, sure. Thank you. So, talking about implementation research, definition of implementation research, if we in short, we can say it is the scientific inquiry into the questions around implementation. So implementation research, this is the subset of health system research, which is used and whose main focus is to find the barriers and facilitators for implementing the interventions. So implementation research, while we implement some interventions or some programs in the setting, the interventions may be the what you call evidence-based intervention. This means they are working well in one setting. Maybe they may not work in the other setting. So this implementation research will help us to know why and how around the success and failure of the interventions in a particular setting, so that it will help us to better plan the intervention as well as better implement the intervention in the setting. So for health research, it is one of the important research to better implement the programs in the setting, and also to scale up the programs from one setting to another setting. Aswin.
Thank you, Basant. And can you discuss a little bit about its relevance to TB program? And if you can just give a little bit of understanding of TB and its current state and why implementation research matters to ending TB.
Yeah, sure. This is one of the important questions. Thank you for this. Actually, implementation research is important not only in tuberculosis program, but also in various health programs, public health programs, because in public health program or health program, we are implementing programs in different setting of healthcare system. So by implementing the implementation research along with the implementation of the interventions, we can know if there is any barriers, any facilitators to implement the interventions, so that we can identify the barriers, we can why the problem is existing, and
Yeah.
how we can improve the interventions. If we go to national, I mean, tuberculosis program
Yeah.
here, because as you know, from the global tuberculosis report, for example, if we take example of global tuberculosis report 2020, we can see that WHO estimates around 10 million cases of TB globally, but in 2019, only 7.1 million were notified to national tuberculosis, globally
Yeah.
notified by national tuberculosis program. This means there is a gap between estimated cases and those reported cases. So this means there are some cases that are missing in the community, and we could not find those cases, we could not diagnose those cases. So this means we are not treating those cases. This means while we don't treat the totally curable disease, that is tuberculosis, they will, in one hand, they will die of tuberculosis, which is a curable disease, and the another in another hand, they will transmit the disease in the community. So it will be difficult for national tuberculosis program to
Yeah.
to find those cases. So now national tuberculosis programs of various countries, they are implementing various interventions to find those missing cases. For
Okay.
example, if we take, this is only the example.
Sure.
For example, if we say national tuberculosis programs are implementing active case finding strategies because by the passive case finding, there are many cases missing in the community. So they will go to the community and implement active case finding strategies. But while implementing active case finding strategies, there are various challenges, various barriers to implement those strategies. For example, in some countries, in some health catchment area of health facility, it will be easier. The what you call people can have easy access to the health facility, so that active case finding strategy might work. But
Yeah.
maybe other settings it might not work. We might have some barriers for that. So while implementing implementation research in those settings, for example, for active case finding
Yeah.
strategies,
Yeah.
we will find if there is any barriers or if there are any facilitators to implement those interventions, so that program planners as well as program implementers in tuberculosis program will find the way to better plan as well as better implement, for example, the active case finding strategy. Another example might be DOTS. uh, DOTS is the directly observed treatment short course. So ideally, the TB patients should come to the health facility to take the
Yeah.
pills in front of healthcare workers. But it's in theory, but in practice, uh, for example, in the setting with the transportation, with the very limited facility of
Correct.
transportation,
Yeah.
people can't come from by using transportation from long distance. So
Correct.
they might miss the pill and they will have a problem to come to the health facility to take TB pill every day. So that might not work. Maybe in that case they might find the barriers for that, and they might have implementation. If we conduct implementation research there, we might find some solution for that barrier, so that dots can be implemented slightly in different way to achieve the target and to achieve to so that the patient can easily get the pill every day. So this is the importance of implementation research in tuberculosis program.
Thank you so much for that very vivid example, Basant, of dots and how feasible it is. Because, like you said, it happens in theory, but then in practice, is not necessarily feasible. Now, that is the perfect segue to the next question. Because now, as you've mentioned, TB and a lot of programs are run at a national level. So, what do you think the challenges or the barriers are for governments or roadblocks even to understanding and deploying implementation research when running programs?
Actually, actually, if we talk about research, not only implementation research, especially in low and middle income countries, because low and middle income countries are the one where there are a lot of tuberculosis cases. Here we are just talking about tuberculosis. Actually, implementation research can be implemented in any health programs to find barriers and facilitators. So let's say in the low and middle income countries where there is a large, I mean, the burden of tuberculosis exists, and they are the one where they are not implementing, I mean, implementation research, because there are various challenges, such as they are not well known about the research, and the research is not the priority for them, because they have other priorities, such as programs. But actually, to implement the program effectively, the implementation research and implementation research will help that. This should be known by program implementers of national tuberculosis programs. Nowadays, it's the what you call the implementation of implementation research in national tuberculosis program is slightly better, but many of the national tuberculosis programs, they are not adopting implementation research or any other research. We are just talking about implementation research because it will help to find the barriers while implementing the tuberculosis programs in lower level setting or the other settings. So main problem is it's not the priority for them, but it should be priority. And they have the challenges for funding, because they are having the majority of national tuberculosis programs are funded by let's say global fund or other funding agency. The drugs are being supplied by some funding agencies. So these are some of the challenges, because they are already having challenges while implementing the programs, and they have the challenges such as funding challenges for implementation research. But actually, for implementation research, it is the research where we don't need much funding. This should be known by national, I mean, tuberculosis program managers, so that they can allocate very less funding for implementation research, and then they can get more outputs from implementation research, because they will know how their program is working in the real setting, and what should they do for betterment of their program. Yeah.
Thank you for that response. And you definitely highlighted key issues such as funding and priorities, especially when you have a myriad of problems that governments have to deal with. So, along those lines, you had mentioned that implementation research doesn't actually cost a lot, and that program managers and policymakers should be able to integrate that funding into programming overall. So, I think a question for you then becomes, how do you as an advocate for implementation research, try to gain support, garner local support, and gain local buy-in for integrating implementation research into programming overall?
Yeah, the first thing we should do is we should advocate for implementation research. We should make the program managers, planners, about the importance of implementation research in health programs. For example, a national tuberculosis program. This will help them to keep priority for national tuberculosis program. Maybe they are thinking that all research will cost a lot of funding for those, and so they are not giving priority for the research. But we can advocate this and so that they can give priority to these implementation research while along with implementing the programs. So yeah, if we let's say if we pilot some of the project with advocacy with them, we can ask them and we can request them to plan some let's say one or two implementation research project along with one or two interventions. They will get the result, and if the result comes, then they will be happy and they will accept that, and they will give priority for their in their budget for next year maybe. Yeah.
And Basant, even you talked about global fund and international donors, they also have a responsibility, right, to in their guidelines, in their program guidelines, before they fund the program, they should put probably some uh, uh, stipulations around how what kind of implementation projects must be integrated within the program, and the funding is conditional upon implementing also those implementation research projects. So is this ethical, and is this like something that can be pushed by donor agencies? Yeah, can you
Yeah,
elaborate on?
yeah, actually, Aswin, in global fund budget also they have a plan to for research and development. Yeah, they do have, but the thing is how those research funding is implemented in real life, whether they are conducting the real research or not. So maybe there is need of implementation research. Maybe they are conducting other research. This means I don't mean that we don't need other research. But if you want to know the bottlenecks of the interventions, implemented intervention, the implementation research are important and low cost research in the settings and can be conducted in lower level setting. So the main thing is there should be acceptance from national tuberculosis program managers, so
Yeah.
that they should for example, if let's say a global fund is working to implement some of the implementation research, and the national tuberculosis managers, they also accept that research and after they kept the research in their regular program,
Yes.
that will be great. And
Yeah.
yeah, that will be easier for implementation of the implementation research and establishing the research culture in the country, so that it will have short term as well as long term what you call effect. Yeah.
Yeah, so yeah, it really starts with educating the people who are in those public health positions. And yeah, for audience members joining, we are speaking with Basant Joshi about the importance of implementation research in national TB programs. So, Basant, in terms of when we look at the projects around TB globally, there's a lot of talk about ending TB by 2025, ending TB by 2030. Are these realistic timelines?
Yeah, Aswin, it's one of the important question. Thank you for this. Uh, yeah, they have set a goal, a global goal to end TB. Actually, some of the countries, majority of the countries, they are in the right track to achieve these goals, but due to this COVID pandemic and
Yeah,
as you know, it is difficult to achieve the goal if all of the countries are not in the right track. So there are various challenges to achieve these goals, and the COVID pandemic this also added the challenges for this achieving this goal. So the what you call UN generals report in 2020, they have also recommended 10 important things that should be considered for achieving these goals by the national tuberculosis programs, as well as WHO and other funding bodies. One of them is the research. So I think it's important to conduct research, especially implementation research, for achieving these goals. Because for example, if you want to conduct some research if you want to conduct some programs, some interventions,
Yeah.
let's say innovative interventions for finding the cases in this COVID pandemic era, to overcome the challenges of COVID, because as you know, the COVID also affect the lungs, and
Yeah.
tuberculosis also affect the lungs, and maybe the people will fear of the COVID, and they don't go to the health system if they have cough and anything that might be the tuberculosis. So,
Yeah. Yeah.
so national tuberculosis programs, they should implement some innovative approaches in this COVID pandemic, but in the same time, they should also think about whether these innovative approaches really helped to achieve the goal, whether these programs are really working. Maybe these new programs might not work in some settings. So to find the barriers and implementers for implementing these interventions, implementation research is important
Really good.
in this I mean COVID pandemic era. I think so.
Yeah. I mean, you raised a very serious point here, where people who might be affected by TB are actually thinking they're COVID, and even the health system is treating them as if they might have had COVID, and also they might be subjected to community negligence as well. Um, and yeah, this is quite a serious issue if you look at it, and it also shows how urgent it is to have those innovative implementation research integrated into the COVID/TB response. So, could you share some experiences, your experiences in Nepal and other countries where TB implementation research projects have actually had an impact in the community?
Yeah, actually, for implementation research, I conducted implementation research activities in Nepal. Maybe I think it's good to share with you. In 2014, I conducted implementation research as part of as I was selected for one of the operational research training. So I conducted one operational research on childhood TB diagnosis. So this paper is cited by many other
Okay.
researchers, and that actually I know from somewhere that now it's being this paper is being uh, what you call reviewed by WHO, and kept this paper as one of the important paper uh,
Okay.
for the operational research paper. So
That's
I think
fantastic.
it will
Congratulations on that.
yeah, thank you. And I think it will really help to better implement the intervention in the what you call low and middle income settings like Nepal. So yeah, they also used in while preparing guideline. So this research paper is also used by cited by National Tuberculosis Program of Nepal. This means
Yeah.
yeah, if we can conduct some implementation or operational research in the community, and if we can do advocacy for those research, so that National Tuberculosis programs or other public health programs, they can
Yeah.
they can use the findings from the research in the real practice. Maybe this will help to better implement the programs. For as you talked about the community level, sometimes there might be the issue of cultural acceptance
Yeah.
for some intervention in the community. So if we conduct implementation research, because there are various outcome variables of implementation research. So if we, for example, if we conduct acceptability of the some intervention, let's say
Yeah.
some
Yeah.
intervention about DOTS or any active case finding strategy. So whether this strategy is against the cultural acceptance, against the
Sure.
culture of that community. Yeah, by doing implementation research, we can find, also we can conduct um, um, contextual analysis, so that we can find what is really against the culture, and
Sure.
what can be done to for better implementation, so that the program will be implemented in better way, and
Yeah.
there is acceptance by the community, and the program is not against the community. So it will help.
In terms of you're currently working in University of Bordeaux as a PhD fellow, and you're studying there as well within the TB Speed project. So, what are you currently um, planning on accomplishing from this project?
Yeah, actually, in this PhD, this is the TB Speed project is the large project, operational research project funded by United, and this is being implemented in various countries of Africa and Southeast Asia, one country of Southeast Asia. So my PhD is there are several outputs in this TB Speed project, and my PhD is around the implementation research component of this TB Speed project. Actually, they are implementing innovative childhood TB diagnostic approaches, and they are decentralizing those approaches to find childhood tuberculosis in the PSC level as well as in the district hospital level. So my PhD research is to find whether these interventions, because they are new in the PSC, and sometimes they are new in the district hospital. So whether these interventions are feasible in those settings, whether they have, what is their acceptability towards this intervention, acceptability of healthcare workers as well as acceptability of parents of the children who are getting who are enrolled in the TB Speed project, and to know other barriers and facilitators for effective implementation of these intervention in those settings. So my PhD is mainly focused on the implementation research part of this TB Speed project.
And before, in terms of when you spoke earlier about the implementation, do you have like a checklist, or do you have like is the guidelines around implementation research of TB projects available publicly, or how does it work for, let us say, someone from a different ministry from which you are not working in different countries interested in adopting best practices in implementation research in their own country. Is this information available publicly? And yeah.
Yes, of course, of course. WHO TDR is WHO TDR is mainly prioritizing this implementation research. As part of that, we were the MPH graduate from University of Gajah Mada, Indonesia. This is funded by WHO TDR. So
Okay.
they are in one hand they are working to find to what you call for implementation research study for the MPS graduates. They are working for that, as well as they are working to develop the tools for implementation research. They have IR toolkit, which
Okay.
has different modules for implementation research,
Okay.
so that we can use we can read that IR toolkit. It is available freely we can search in online to find this toolkit. And recently, the WHO has TDR also has published implementation research toolkit for focused on tuberculosis program as well. And another thing is uh, TDR has launched implementation research MOOC course. MOOC
Oh,
course.
okay.
It has, yeah, it has the different modules for that with deadline to complete those modules
Okay.
and targets for completing those modules, and finally you will get the certificate of this research. I mean, this course, I also did that course, so I suggest those people who are working in health system, especially in low and middle income countries. It is an important course, and you can apply for that course when it is open by TDR, and then it's
Okay.
free of cost,
Yeah.
but it will polish your knowledge. Yeah, I think it's important.
Thank you.
Thank you for sharing your field experiences in implementation science, and also for those resources. That's really helpful for our audience. For anyone just joining us, today we're interviewing Basant Joshi on implementation research and national tuberculosis programs. We've done an overview of implementation science. So, Basant, as you rightly said, implementation research and implementation science in general hasn't necessarily had the has just been gaining recognition over the past couple of years, and really researchers and policy makers really advocating for it, including funders as well. What has been your path to being a specialist in implementation science?
Yeah, actually, as you know, I'm doing PhD, especially focused in implementation research. I did my master's MPH. That was also focused on implementation research in tropical diseases. I did research on implementation research and tuberculosis program. So my career path is like after doing a PhD, I will mainly focus on implementation research, especially in low and middle income countries, so that I can contribute for improving the health system of low and middle income countries through this implementation research projects and implementation research finding. Yeah,
And also, congratulations on just contributing to the body of knowledge in TB programming.
thank
So,
you.
along those lines, you've had a rich history, like you've rightly said, in your path to implementation science. So, what advice would you have for young professionals who are interested in specializing or learning more about implementation research and implementation science?
Yeah, for the young learners, I would like to say that research is important, and today, as we are discussing about implementation research is important. Not only for the career in research, but also if you want to involve in the health programs, public health programs in various settings. If you have knowledge about implementation research or any research, for example, if you have knowledge about implementation research, you can easily know how to conduct implementation research in the setting where you are implementing some of the evidence-based interventions. So you can conduct implementation research, you can advocate for implementation research, and you will know how implementation research will really helpful to implement your program. Maybe you will be the program manager, and then you will find the importance of implementation research. So I think whether you are planning to for the planning the career in implementation research, any research, or for the programs, it's important to have knowledge about implementation research or any research so that it will help in your career path. So nowadays we have very various online resources for research, which can, so that you can use those resources. You can have some webinars in research. You can have some webinars in implementation research, so that you can source those, you can read, you can participate, and you can get knowledge of implementation research. Sometimes you can collaborate with some of the agencies. They are happy to collaborate, because this is one of the new field of research. And it is important for low and middle income countries to better implement the programs in various settings. So I would like to suggest to have idea about implementation research. If you want to have materials, I already told that you have free materials provided by TDR, WHO. So you can have that, and you can also talk with some of the experts. You can have contact with some of the experts on implementation research. It's good.
Like experts like you.
Yeah,
There we go.
I'm learning. Yeah, I'm learning. But I will be happy to share my knowledge gained during my MPS, during my while working for National Tuberculosis Program in Nepal, while doing some research in low and middle income countries, and now also I have the opportunity to visit various our implemented implementers country.
Yeah.
So recently, I came from I went to Sierra Leone and Uganda as well. So it's the opportunity to learn more by doing practice, and
Mhm.
also in the while I'm in the field. So I would be happy to share my knowledge with young researchers, especially in implementation research.
Thank you for that kind offer. This is the time where we take audience questions, and I know we have an audience question from Indira Kadambi. It says, what parameters other than acceptability are measured in implementation research of TB programs?
Yeah, there are many parameters. We call outcome variables of implementation research, such as feasibility can be measured, feasibility of any intervention that is implemented in certain setting. We can measure the feasibility of some tuberculosis program. We can measure the fidelity of the delivery of the program. We can measure the acceptability. We can also measure the sustainability of those implemented programs, and also the scalability. We can if you want to scale up, because it's important to scale up the intervention. First, we implement intervention in one particular setting. We will see how that intervention is working. For example, TB speed interventions that we are now implementing in let's say six countries, and in two districts of each country, and five health facilities of each districts. So this means this is only the representation, and from here we will know how these interventions are working, what is the feasibility of this intervention, what is the acceptability, what is the scalability, so that we can scale up these intervention to other settings as well. Yeah. So there are many outcome variables in implementation research.
Super cool. And in terms of future aspirations, Basant, what are your future aspirations, and also future aspirations for the field of implementation research when it comes to improving TB programs?
Yeah, my future aspirations will be I will work I'll probably work in tuberculosis program, because I'm working in tuberculosis program for a few years now. And as you know, I did my research project in tuberculosis and implementation research in my master's program. And in PhD also, my PhD is focused on implementation research and tuberculosis. This is childhood tuberculosis. So probably I will work for tuberculosis and implementation research, because I think implementation research is not what you call implemented properly, or it is not the priority for low
Yeah.
and middle income countries, and it should be the priority. So we should talk about this. We should plan the talk show like this, so that others or national tuberculosis program managers, they can know the importance of implementation research for better implementation of tuberculosis program, so that in future we will surely see that implementation research is implemented in the national tuberculosis program, and all will see the impact of implementation research in tuberculosis program, and also other health programs. So my aim is to work for implementation research and tropical disease like tuberculosis and other also.
That is fantastic.
Yeah, it is. And we have actually we're coming to a close with our program, and we just want to thank you again, Basant, for sharing your experience, providing that overview on implementation science and research, sharing your very rich field experience. Congratulations again on your publication that is being used to develop guidelines for national TB programming. We do have time for one more audience question, because I think it ties in with your future aspirations for implementation science. It asks that, are there currently any global organizations focused on advocacy for implementation research in health interventions?
Yeah, actually, we can say TDR is focusing what you call to develop the guidelines, and to work for what you call implementation research, because for example, in Nepal now we have many graduates in implementation research. Now they can implement implementation research, and they can advocate for implementation research in their setting. So I would like to thank TDR for this, and now still they are working to have various courses and various programs for implementation research. I think this will help to advocate implementation research to national tuberculosis program or other health program as well.
Yeah, that's helpful. And that advocacy would need to be at the field level, at the subnational level, and at the national levels and the global levels overall. So we appreciate the work of TDR and
Yeah.
all the other organizations trying to make implementation research be at the forefront of health programming.
Yeah,
You have kindly,
adding on this, maybe we have one group. That's the group I can say IR Connect for those who are the alumni of implementation research, because as you know, implementation research that is funded by TDR. TDR funds implementation research for MPH in all the region of the world, such as Southeast Asia, Africa, and various regions. So, so we have the IR Connect, where we have sometimes we have a meeting about implementation research, sharing about implementation research. So I think these will also help for advocacy. Yeah.
thank you for sharing the details on IR Connect. You had previously kindly offered to speak with anyone interested in implementation research, share your experiences. So, what are your social media handles and how can people reach you?
Uh, yeah, but I'm using Facebook. You can reach me via Facebook. You can search Basant Joshi, and you can see my see my picture. Or if you want to, I have a Facebook account in Basant Joshi @yahoo.com. So, or you can just search Basant Joshi and you can see my photo.
Okay.
Yeah.
Also, I think you're on LinkedIn as well, right?
Yeah. Yeah. Sorry. I'm also in LinkedIn and also in ResearchGate. You can find me there. You
Okay.
have to search Basant Joshi, then you can. And my email address for LinkedIn will be basantjoshi26@gmail.com. Yeah.
So, well, this
Um,
has been an excellent conversation, Basant. You were saying something, Mimunu?
no, I was just echoing your thanks to Basant
Yeah.
for this conversation, for answering questions. I personally, whilst I have been involved in implementation research, not from the expert level, but from an implementation and programming level. It definitely underscores that in the importance of ensuring that all those outcome parameters you mentioned or outcome variables are included, because like we all know, we don't have infinite resources in global health or even in the world at large. The needs are unlimited, but the resources are limited. So often we would have to ensure that our programs are feasible, they are scalable, and they are sustainable to really bring about true change. And as you know, health equity has been on the forefront of conversations over the last several decades. It's become even more imperative to ensure that our health programs are really meeting the needs of the populations that we serve. So
Yeah.
thank you once again for lending your time and expertise to this. To our audience, we thank you for your time and engagement. We thank you for your patience. Please like and subscribe to our channel. Provide feedback on topics and key global health issues you would like to see of researchers, implementers, experts on the field that are really the unsung heroes that we would like to highlight on this channel. And we welcome you to participate with us and collaborate with us in any way possible. Thank you once again for your time, everyone, and have a good day. Be safe and be well.
Thank you,
Okay,
Alar,
everyone.
for giving me this opportunity to share my knowledge with audiences and to share my experiences in implementation research and the tuberculosis program. Thank you so much.
Our pleasure,
Namaste.
Basant.
Namaste.
Namaste.
Thanks a lot.